Mrs. Jones. Hello, Joanne. My name is Jessica, and I'm going to be your student nurse today. I'll be doing Joanne's assessment.
Oh, okay.
So how are we doing today, Mrs. Jones?
We're doing pretty good.
Great. So, I'm going to just pull privacy, and I'm going to check our band here. Joanne, can I see your arm, please?
Oh,
Thank you so much. Okay, so you can see her name is Joanne Jones, and her birth date. What is your birthday, my dear?
my birthday's in June.
Okay, June. Do you know what day?
The 14th.
Okay, and what is her birthday month?
She was born in 2004.
Okay, great. Does she still have a allergy to penicillin?
Yes.
Okay, so before we came into the room, we went ahead and got our weight and height in the hallway. So I went ahead and tried those on our on her growth chart, and I also assessed her gait. So what we're going to start off with is getting you to a working height. So Joanne, how is school going?
It's good.
Great. What grade are you in?
I'm in kindergarten this year.
Yeah, is that fun?
Yeah, I like my teacher. She's nice.
Nice. What's your favorite thing in school?
I like recess.
Yeah? It's pretty
Yeah.
fun, huh?
Yeah.
Okay, so is she on any medications?
She does take Flintstone vitamins, but that's pretty much it. Yeah.
Any prescription medications?
No.
Okay. How about any like chronic diseases or conditions?
Nope, we haven't had any issues
Okay.
with like asthma or anything.
Okay, great.
So.
That's awesome. Okay, so Joanne, I've got a cool sheet here, and this is called pain assessment, which just means there's smiley faces, and this smiley face means you don't hurt anywhere or at all. And this smiley face means you are feeling a lot of pain. So, how are you feeling today?
That green one, like the dark one right there.
Yeah? You don't have any pain?
I don't have any.
Great. All right. So, what I'm just going to do is we're going to start off, and I'm going to take your temperature, okay?
Oh, okay.
So, have you ever seen one of these before?
I think so.
Okay, it's called a thermometer. So, it's really easy. You just clean it off, and you go over here, take your temperature. So, I'm going to be doing that to you, okay?
All right.
All right, so per provider's order, I'm going to be taking her temperature for the method that's prescribed. So I'm recording her temperature. So I'm going to be looking in your ears too now, okay?
Oh, okay.
All right, so I'm going to be pulling your ear a little bit, okay? So I'm going to pull it up and back. She's a 6-year-old female, so that is why we are pulling up and back. Okay, and normally I would go around to the other side of the bed. So I'm gonna ask about her vision. So has she complained about any blurriness, dizziness with her vision?
She hasn't, and she did recently have a visual check at school.
Okay, great. And how about any headaches?
Nope, I don't think so.
No?
Not.
Okay, I'm just gonna be testing the patency of her nares. Okay, and see here, it looks like you lost a tooth recently. Did the tooth fairy give you any money?
Yeah, she gave me $5.
Wow, that's awesome.
I know.
All right, so I noticed there's no dry or cracked lips. She said stage where she's losing teeth, so that's normal. So I'm just gonna notice her neck. There's no like swollen lymph nodes. Her neck is midline. So now I'm just going to give you my stethoscope to check it out. Okay?
Oh, okay.
We're gonna clean it off. Have you ever seen one of these?
Yeah, I think so.
Yeah, they're pretty cool. So what I'm gonna have you do is I'm gonna show you can listen to your heart. Okay?
Okay.
All right, so she's going to check out her heart, and I'm going to be assessing her radial pulses. So I find that they are both bilaterally equal, as well as her brachial pulses. And her skin is warm and dry and looks healthy. All right, so can I have my stethoscope back? How would you like that?
It was kind of cool.
Kind of cool, right?
Mhm.
Yeah, I think it's pretty neat too. So I'm going to clean my stethoscope off, and we'll be listening to her lung sounds. So can you take a deep breath for me? Okay, good job. And again. Okay, and again. And, all right, perfect. And I'm going to listen to the back of her lungs as well, where she's happy. And we would normally do that with a normal patient. So now I'm going to listen to her apical pulse for 1 full minute. And, okay, perfect. And if her apical pulse was less than 60 beats per minute or more than 160 beats per minute, that would be cause for concern, and we followed up with the provider. So I'm just going to be taking your oxygen now, okay? This is just going to show how well your kind of breathing, and when I walked in, I would have also noticed her respirations. So notice how, like, is she laboring with her breathing? Is she doing rapid breathing? Is it too slow? When I walked in, I also would have noticed her general appearance, such as her skin color. Does she look like she's sick, like a red nose, dark under the eyes? But she's healthy and she's doing good. So I will chart her oxygen and take do the cap refill test, which looks good. All of her fingers, perfect. So now I'm just gonna be looking at your tummy, all right?
Oh, okay.
All right, thank you. So I'm going to look at her abdomen, and I see there's no edema, there's no distension. I'm going to be listening to all 4 quadrants, and all right. You must be hungry. It's about lunchtime, huh?
Yeah, we were gonna go to McDonald's.
All right, that's awesome. All right, so all 4 quadrants are active, and okay. So now I will just be lightly palpating, and I don't want to do this too much because you might be ticklish, huh? Okay. So, Mom, can I ask, has she had any constipation, things like that?
She has not had any constipation recently.
Okay.
No.
How about like diarrhea, nausea,
No.
nothing like that?
Mm-mm.
Okay. When is her last bowel movement?
I'm pretty sure it was yesterday.
Okay, great. All right. So, how about bedwetting? Is she still wetting at nighttime, maybe?
Nope, we're out of that stage.
Great.
So yeah, it's been good. She probably hasn't left the bed for over a year now.
Okay, good. How about like any daytime incontinence?
Not that I know of. Her teachers, I think, would have said something.
Okay. And how about like when she does urinate, she complains of any burning or some like pain?
She hasn't, no.
Okay, fantastic. Okay, so I'm just gonna look at your legs now, alright?
Oh, okay. Mm-hmm.
Okay, so looking at her legs, I'm going to be watching for again, warmth and skin tone. I'm going to be checking for any edema, which there is none. I'm going to be checking her capillary refill on her toenails, which is good, and assessing her pedal pulses, which are bilaterally equal. Okay, perfect. Joanne, you're doing so good.
Thanks.
You get an A+ today.
Oh, thank you so much.
All right. So, if she had any special needs, I would assess for that, like ostomy or NG tube or seizure precautions, for example. And I'm also going to make sure the room is safe by lowering the bed, and also making privacy, make sure there's no cords, nothing that the child can hurt herself with or anyone can trip over. Are there any questions that you have for me today?
I don't think so. I think we'll wait for the provider.
Okay, provider will be in soon. Thank you both very much. Well, guys, have a great day.
Okay.
All right, and I will just sanitize my hands and then chart the rest of my findings, and let's go.